Talking about masturbation among older people is still a big taboo for many. For centuries, society has constructed an image of old age as a phase exclusively devoted to rest, silence, and withdrawal from physical pleasures. Aging has been associated with decline and renunciation, especially when it comes to sexuality. As a result, millions of older men and women experience an internal conflict. They feel desire, curiosity, pleasure, but also guilt, shame, and even fear of being judged or considered inappropriate. This conflict is not natural. It is learned, and that is exactly why it needs to be deconstructed. Masturbation is an intimate and personal expression of affection for oneself. It exists in all stages of life, adapting to changes in the body, desire, and emotions. When it comes to older people, masturbation is not only still possible, it is still healthy, pleasurable, and even recommended by mental and sexual health professionals. However, the lack of positive representation of sexuality in old age fuels a distorted belief that this type of pleasure is no longer appropriate. This is a myth, and like all myths, it needs to be dispelled with knowledge, sensitivity, and respect. If you're new here, leave a like and subscribe to the channel so you don't miss any videos. Many older adults have carried religious, moral, and cultural teachings from their youth that viewed the body and pleasure as something dirty or sinful. They were taught to hide their desires, deny their wants, and repress their sexuality in the name of a supposed virtue. Time has passed, values have changed, but these marks are still present. So even when they feel comfortable in their own bodies, even when they are alone and safe, many still ask themselves, can I? The answer is yes. You can, and more than that, you deserve to. You have the right to live your sexuality fully, free from judgment. It is important to understand that sexuality does not disappear with age. It transforms, and masturbation can be a powerful tool for rediscovering this new body, this new time. With advancing age, hormonal, emotional, and physical changes are natural. The skin becomes more sensitive, lubrication may decrease, and sexual response may be slower. But none of this prevents pleasure. It just requires attention, care, and, above all, acceptance. Masturbating can be an act of reconnection, of listening to your own body, of cultivating tenderness. It is a way to stay alive, present, and whole, even when the world insists that it is time to retire. More than a physical issue, masturbation in old age is also a political and emotional statement. It is an act of resistance against the idea that pleasure has an expiration date. It is a way of reaffirming autonomy over one's own body, of placing oneself at the center of one's own life, even after decades of caring for others, building families, facing pain and responsibilities. Many women, for example, only discover true sexual pleasure in maturity, far from the pressures of performance or the obligation to live up to their partner's expectations. Many men, when freed from the anxiety of sex as a proof of virility, find in masturbation a space of acceptance and self-knowledge. There is also a health aspect that needs to be highlighted. Several studies show that masturbation can help relieve stress, reduce insomnia, improve mood, and even strengthen the immune system. It is a safe, intimate, and natural practice that directly contributes to physical and emotional well-being. In addition, knowing your own body is one of the best ways to notice changes, pain, or discomfort that may indicate health problems. Masturbation, therefore, is also a form of self-care and dignity. What prevents many older adults from feeling comfortable with it is often silence, a silence that is imposed, cultivated, and repeated by families, religions, schools, and the media itself. But this silence does not have to continue. Talking about masturbation in old age opens the door to broader conversations about the body, desire, autonomy, and affection. It allows older people to recognize themselves as whole beings, not just as parents, grandparents, patients, or retirees. It allows us to see in them the continuity of life, with all its complexities, including pleasure. When approached without prejudice, masturbation can be an ally in building a lighter, freer, and happier old age. And for that, the first step is to recognize that desire is legitimate, natural, and human at any age. Shame does not belong to the body. It is taught, and what is learned can be questioned, unlearned, and reinterpreted. Pleasure, on the other hand, is born with us. And if we know how to listen to it with respect, it can accompany every stage of our existence, including and especially maturity. When talking about pleasure and well-being in old age, many forget to consider the sexual dimension as a fundamental part of health. For a long time, masturbation was seen only from a moralistic perspective or reduced to simple sexual tension relief. However, it goes far beyond that. Masturbation, especially in maturity, can become a powerful tool for emotional balance, physical relief, reconnecting with one's own body, and strengthening overall health. It is not just an isolated act of pleasure. It is also a gesture of deep self-care that directly influences the quality of life of those who allow themselves to experience it consciously. On a physical level, the benefits of masturbation are wide-ranging and scientifically recognized. When sexually stimulated, the body releases a series of natural chemicals, such as dopamine, oxytocin, and endorphins, that have direct effects on well-being. Dopamine is associated with pleasure and motivation, providing that feeling of satisfaction after orgasm. Oxytocin, known as the cuddle hormone, strengthens emotional bonds, lowers blood pressure, and can even improve immune system response. Endorphins act as a natural painkiller, relieving muscle aches, migraines, and discomfort typical of aging. For older people who live with chronic pain or muscle tension, masturbation can provide natural relief without the side effects of medication. In addition, during sexual arousal, there is an increase in blood circulation. This is especially important for older adults, as it stimulates blood flow to the pelvic region, which can prevent problems such as vaginal atrophy in women and erectile dysfunction in men. Regular masturbation helps keep genital tissues active, which promotes intimate health and may even help prevent urinary tract infections and vaginal dryness. This type of intimate care, often neglected in older adults, can be promoted gently and naturally through conscious touch and solitary pleasure. But it's not just the body that benefits. The emotional impact of masturbation in old age is equally significant. At a time in life when many people face loneliness, loss, changes in family dynamics, or feelings of social invisibility, being able to maintain a pleasurable connection with oneself becomes an emotional anchor. Masturbation allows you to rediscover your own intimacy, reduces anxiety, and considerably improves your mood. There is a silent acceptance in the touch that comes from within, a confirmation that the body still feels, that it still responds, that it is still a place of pleasure, not just limitations. In many cases, masturbation in old age also contributes to strengthening self-esteem. This is because society imposes an ideal of beauty and vitality centered on youth, which causes many older adults to reject their own bodies. By allowing themselves to feel pleasure, even with wrinkles, signs of aging, and natural changes, people begin to see their bodies with more kindness. Solitary sexual practice can then become an affirmation of self-love, a moment where there are no external demands, comparisons with standards, or judgment, but only presence and acceptance. Another point worth noting is the role of masturbation in self-knowledge. Throughout their lives, many people live their sexuality focused on others, satisfying partners, following expectations, fulfilling roles. Over the years, and with more time for themselves, it is possible to rediscover what really gives pleasure, and this can be surprising. Some people, already elderly, experience intense orgasms for the first time. Others discover that they prefer a different rhythm, previously ignored stimuli, or new ways of touching their bodies. This process of discovery can be deeply liberating, as it allows sexuality to be experienced in a more authentic and personal way. It is also important to remember that masturbation can serve as preparation for sexual relations with partners if you have them. It helps you understand changes in sensitivity, identify what brings you the most pleasure, and better communicate your desires in a romantic relationship. For those in relationships, this can strengthen intimacy and even relieve marital tensions. For those who are single, it offers the certainty that sex life does not need to depend on another person to exist or make sense. It is a part of you and can be accessed at any time with care and respect. Even when the body has more severe limitations, such as mobility problems or chronic illnesses, it is possible to adapt the practice of masturbation with creativity and patience. Using support cushions, choosing quieter times, exploring parts of the body beyond the genital areas, or simply engaging in sensitive and affectionate touch are all ways to keep pleasure present. After all, masturbation does not have to be performative. It needs to be meaningful. It needs to make sense to those who experience it, within the real possibilities of that body, that moment, and that person. Masturbation, therefore, is far from being a simple solitary habit. It is part of a broader view of health, freedom, connection with one's own body, and emotional vitality. Even in a world that still silences pleasure in old age, the practice offers a daily chance for reconnection, autonomy, and celebration of the life that still pulses, with or without company. As time passes, the body changes. This is inevitable. Aging transforms the skin, muscles, bones, organs, metabolism, and of course, it also influences the way we feel pleasure. The problem is that most people reach maturity without having been educated to deal with these changes in a natural and welcoming way. On the contrary, we are taught to hide, deny, or fight any signs of aging, as if aging were a mistake. When this applies to sexuality, the situation becomes even more complicated, because the body that was once a source of pleasure and discovery begins to be seen only as a body that no longer works as it used to. And that's where many people give up. Not because the desire is gone, but because they believe they no longer have the right body to feel it. The first step to rediscovering pleasure during the aging process is to understand that physical changes are not the enemy. They just require new paths. Arousal may take longer to arise, orgasms may come differently, lubrication may not happen as easily, erections may be more sensitive to stress or fatigue. None of this means that pleasure is over. It just means that the body is asking for a different rhythm, a different way of listening, a different way of being touched and understood. It's as if the body is telling a new story, and to hear it, you have to strip away old ideas about what it means to be good in bed or what it means to work right. Adapting with care means looking at your own body, not with judgment, but with curiosity. Instead of lamenting what is no longer as it once was, you can discover what is now possible. Some people report that with maturity, they have developed a more sensory relationship with touch, paying more attention to small gestures, lingering caresses, and stimuli that were previously ignored due to haste or insecurity. In this context, masturbation can be a therapeutic practice, a way to relearn the pathways of your own body without rushing, without pressure, without comparing yourself to the past. The practice becomes a moment of silent intimacy, where touch does not need to be performative or follow old scripts, but only sincere, present, and attentive. Another important aspect is the use of resources that facilitate this rediscovery of pleasure. Vaginal dryness, for example, is a reality for many women after menopause. This can cause discomfort, pain, and even injury during penetration or more direct touch. However, with the use of water-based or vegetable oil lubricants, it is possible to transform the experience into something comfortable and enjoyable. The same goes for men who have difficulty maintaining an erection. The use of varied stimuli, massage, sex toys, or even medications prescribed by doctors can help restore confidence and pleasure. More than that, these resources show that pleasure is not a one-way street. It can be expanded, explored, and rediscovered in new ways of feeling. It is also necessary to talk about the emotional relationship we have with our bodies. Many people, especially women, reach old age with a sense of debt to their own bodies. They have spent their lives trying to fit into aesthetic standards, fighting against aging, and ignoring their own desires in the name of others. In maturity, this pressure can intensify, and every wrinkle, every sag, every scar is seen as a flaw. In this scenario, pleasure can seem like a distant luxury, but touch, when accompanied by acceptance and kindness, can become a powerful antidote to this self-criticism. Touching your own body with affection, without the obligation to reach orgasm, but with the desire to embrace and recognize yourself, is an act of resistance against a culture that tries to erase the beauty of the mature body. Another often overlooked point is that pleasure does not reside solely in the genitals. As genital sensitivity may decrease somewhat with age, other parts of the body take center stage. The nape of the neck, the back, the abdomen, the breasts, the thighs, the feet, the hands. The skin itself becomes a vast field of sensory experimentation. Masturbation can go beyond direct touch and involve massage, conscious breathing, imagination, sounds, textures. Rediscovering these paths expands the concept of sexuality and makes the experience even richer and more connected to the present. Maturity allows precisely this, to go beyond haste, obligation, mechanics. Pleasure can and should be deep, conscious, integral. These adaptations require an active but gentle approach. Instead of blaming yourself for not feeling the same as before, you need to open yourself up to the new. It's not about forcing your body to respond the same way it did when you were 20 or 30. It's about asking your body, now at 60, 70, or older, how do you want to be touched today? This listening can be surprising. The body is not an enemy. It is a home, and even if the rooms change, the windows close, the furniture is moved, it remains our place of residence. And like every home, it deserves care, merit, and love. When it comes to masturbation in old age, many people still believe that the only tool available is their own body, as if erotic accessories were something exclusive to young people or those who live a sexually adventurous life. But this idea is limiting and unfair. Erotic products, especially those aimed at self-knowledge and individual stimulation, can be powerful allies for mature men and women who want to maintain or rediscover pleasure in their routines. Far from representing something artificial or distant from intimacy, these items often prove to be bridges between desire and the body, facilitating touch, enhancing sensitivity, and offering possibilities that may not have been imagined before. One of the first products worth mentioning is intimate lubricant. With aging, it is common for the body to produce less natural lubrication, especially among women after menopause, but also in men under certain hormonal or clinical conditions. This is not a sign of dysfunction, but a natural physiological process. The good news is that choosing the right lubricant can completely transform the experience of pleasure. Water-based lubricants are the safest and most compatible with most bodies and toys, providing smoothness, comfort, and preventing friction that could cause discomfort. Silicone-based lubricants offer longer-lasting lubrication, ideal for those who want to explore touch for longer. There are also lubricants with extra properties, such as a warming or cooling effect, or even moisturizers with hyaluronic acid designed especially for postmenopausal women who suffer from more intense dryness. Choosing a good lubricant is, in itself, an act of care and listening to your body. Another category of products that deserves attention is vibrators and stimulators. There are a multitude of models and technologies on the market today, and many of them are designed for those seeking softness, discretion, and practicality, characteristics that perfectly match the needs of maturity. Bullet vibrators, for example, are small, quiet, and allow for gentle stimulation of specific areas. They are great for those who are just starting out or rediscovering pleasure, especially for women who want to explore the clitoris with more control. Anatomically designed vibrators can be used for internal and external stimulation at the same time, offering a more complete experience. Many of them have adjustable intensities and varied vibration modes, allowing each person to find the rhythm that best suits their current sensitivity, which may well have changed over the years. For men, there is also a wide variety of accessories designed to stimulate the penis comfortably and effectively. Capsule or tube-shaped masturbators, coated with soft materials that mimic the feel of skin or internal tissues, can provide a more immersive and less repetitive pleasure. Many of these products come with vibration, varied internal textures, and even heating, simulating a more natural and welcoming environment. In addition to pleasure, these accessories can also help men who experience erectile difficulties to maintain stimulation and regain confidence in their bodies. There are also penis rings, which can be used safely to prolong erections and increase the intensity of sensation during orgasm, always with care and respect for the body's limits. A special category that has been growing in recent years is that of non-contact stimulators. These devices, usually aimed at the clitoris, use gentle pressure and suction waves to provide a different, less direct, more progressive type of pleasure. Women who no longer feel the same response to traditional touch may discover a new way of experiencing pleasure with these devices. Deeper, slower, more vibrant. These tools require little physical strength, making them easy to use even for those with limited mobility or arthritis, for example. In addition, many of these devices have a discreet, quiet, and elegant design which helps break the stigma that sex toys are scandalous or vulgar objects. It is also essential to highlight products aimed at intimate well-being that complement the sexual experience. Moisturizing creams and gels specifically for the vulva or glands, cleaning sprays for toys, body oils for sensual or relaxing massages, all help to transform masturbation into a ritual of care and not just an isolated act of physical pleasure. These are small gestures that add up to a lot: preparing the environment, choosing a product that respects the skin, dedicating time to conscious touch. All of this strengthens the bond with one's own body and expands the possibilities for connection with oneself. More important than the product itself, however, is the change in perspective that it represents. When you buy a lubricant, a vibrator, or any pleasure accessory, you are saying to yourself, I allow myself to feel, I take care of myself, I value my body. And that statement carries enormous weight, especially at a stage in life when so many people are taught to give up their desires. Having a sex toy is not a sign of neediness or loneliness. It is a sign of autonomy, freedom, and emotional and sexual maturity. Pleasure no longer has to depend on another person, ideal conditions, or youth. It is available now, here, in the body that exists at this moment. Talking about masturbation, especially in adulthood, is still a challenge for many people. Even though we live in an era where almost everything is discussed freely, the sexuality of older people continues to be pushed into a silent corner, treated as if it were something that should remain hidden, secret, or even non-existent. This creates a heavy barrier that prevents important conversations, not only with partners, but also with doctors, therapists, friends, and above all, with oneself. And it is precisely this lack of conversation that fuels shame, fear, and the feeling that there is something wrong with wanting to feel pleasure after a certain age. However, shame is not something we are born with. It is taught, constructed, and shaped by a culture that tries to separate the body from affection, desire from dignity, and pleasure from maturity. Shame sets in when we are told, often indirectly, that we should not talk about how we feel. From an early age, many of us have been taught to lower our heads, hide what gives us pleasure, pretend that our bodies do not pulsate, that desire does not exist. This silence accompanies us throughout our lives, but intensifies over time. When we reach old age, it turns into a kind of invisible censorship, a block that seems natural, but is actually the result of prejudice and outdated ideas. That's when the suffering begins, not because desire has disappeared, but because the person feels alone with it. Talking about masturbation, about pleasure, about what the body still feels or wants to feel, is not vulgarity, it is humanity. It is affirming that as long as there is breath, there will also be space for touch, for discovery, for intimacy. Starting this conversation can seem scary, but the secret is to choose the right spaces and connections. Not every conversation needs to be public, and not every dialogue needs to be full of difficult words or technical language. Often, talking about pleasure starts with a simple question to your doctor. Is there anything I can use to feel better when I touch myself, or is it normal that I still have desire? These questions, when asked honestly and without fear, open doors. Doctors, therapists, and health professionals are increasingly prepared to deal with issues related to mature sexuality, especially when they realize that the person is willing to take care of themselves holistically. The body, after all, is not just made up of vital organs. It also feels dreams and desires. In the context of a romantic or marital relationship, talking about masturbation can be even more delicate. This is because many people still see solitary pleasure as a kind of betrayal or a sign of dissatisfaction with their partner. But the truth is that masturbating is not an act against the other. It is a gesture of personal listening. Sharing this with a partner can strengthen intimacy, not break it. A sincere dialogue can start with something like, "I've been rediscovering my body in a different way," or "I've realized that certain touches feel good to me and I wanted to share that with you." It's not about justifying yourself, but about including the other person in what is also part of you. Relationships that can talk about pleasure grow, mature, and become more real, more human, more alive. There is also the possibility, and often the need, to talk about the subject with therapists. Sexuality beyond the physical is also an emotional dimension. We carry pain, trauma, and blocks that directly interfere with how we feel pleasure. Talking to a therapist about masturbation can help dismantle the ghosts that time has crystallized: guilt, fear of judgment, feelings of inadequacy. The therapist is not there to judge, but to listen with respect. And this listening, when it takes place in a safe environment, can be liberating. Sometimes the simple act of saying out loud that you want to touch your own body and that it gives you pleasure is already a big step towards acceptance. And perhaps most important of all is to start this conversation with yourself. Look in the mirror, recognize the body that exists now, with everything it carries: wrinkles, marks, stories, and ask that body what it feels, what it wants, what it is afraid to feel. Talking to your own body is often more difficult than talking to anyone else, because there you can't lie, hide, or run away. But it is also in this intimate space that you can find the truest answers. Perhaps the first step in overcoming the shame of talking about pleasure is to allow yourself to listen to it, in silence, in touch, in small daily discoveries. For a long time, masturbation was treated as something shameful, selfish, or even unnecessary, especially when associated with maturity, as if the desire to touch one's own body were a whim, an exaggeration, a childish or vulgar attitude, as if pleasure, after a certain age, should be forgotten, silenced, or transformed into a memory. But this idea stems from fear of the body, of pleasure, of freedom, and where there is fear, there is control. To say that masturbation is selfish is a subtle way of saying that your pleasure doesn't matter, that it's only worth feeling if it's for someone else, through someone else, or because of someone else. However, the truth is exactly the opposite. When someone allows themselves to take care of themselves with affection, when someone offers themselves a moment of pleasure and listening, they are practicing one of the most beautiful and profound acts of self-care. Self-care is not just taking medicine on time, eating well, or getting routine checkups. Those things matter too, of course, but there is a quieter, more intimate form of care, more invisible to the eye, one that has to do with how we touch ourselves, how we listen to ourselves, how we respect our most subtle desires. Masturbation, in this context, is not just a search for immediate pleasure. It is a ritual of listening to the body. It is a way of reconnecting with what still vibrates, still pulses, still desires. And this has enormous power, especially for those who have spent their lives putting others first. How many mature people have lived entire decades being a mother, father, worker, caregiver, provider, and forgotten themselves? How many times has the body itself been put on the back burner, in silence, waiting for the right moment that never came? Masturbation, in this sense, is a gesture of resumption. It is saying, I exist too, I deserve it too. Allowing yourself to feel pleasure goes against many voices we have been taught. The voice of strict morality, punitive religion, and a society that imposes standards. Voices that said the body should be repressed, that desire should be hidden, that touch was sinful. And even when these ideas are no longer verbalized, they continue to echo in the back of the mind, generating guilt, discomfort, fear. So when a person masturbates consciously and without guilt, they are confronting these inner voices. They are saying that they can feel pleasure without being condemned, without being less worthy, without being less respectable. They are quietly building a new relationship with their own body, one that is freer, more compassionate, more whole. And it's important to say, there is no right age to start truly taking care of yourself. Some people only discover masturbation after they turn 60, 70, 80, and that's not too late. It's the right time for them. And every time they touch their bodies with attention and respect, they rewrite their stories. Stories that may have begun marked by repression, fear, or ignorance, but can now be rebuilt with affection. Touch, when done with presence, is not only physical, it is also symbolic. It is a message to the soul. You are valuable. You can enjoy yourself. yourself. You can give yourself pleasure. And it's amazing how this message transforms not only sexuality, but also self-esteem, mood, and everyday vitality. There is also something deeply political about this self-care. In a culture that insists on erasing the sexuality of older people, that insists on saying that the mature body should be neutral, erased, invisible, masturbation becomes an act of resistance. Resisting erasure, resisting silence, resisting the idea that pleasure is a privilege of youth. Every mature person who allows themselves to feel pleasure is, even without knowing it, saying to the world, I am still here. I can still do it. I still feel. And that is powerful. It is revolutionary, even if it happens in an intimate way in the silence of the bedroom, without an audience, without a show. Calling masturbation selfish is a cruel way of invalidating the autonomy of bodies, because deep down, it bothers us precisely because it is a free choice, a choice that does not depend on the desire of another, on the acceptance of another, on the presence of another. It is a form of intimacy that begins and ends in itself, and for that reason it is feared. But the freedom to feel without dependence is one of the most important achievements of maturity, because over time, we learn that others can be companions, they can be exchanges, they can be sharing, but they should never be the only source of pleasure or validation. When pleasure comes from within, when it is born from the touch you know, from the skin you hear, from the will you respect, it is much more than physical. It is a sign that life continues to pulse, even when the world insists on saying it doesn't. Talking about pleasure in maturity is also talking about responsibility for one's own body. The experience of masturbation and sexuality in general is not just a matter of desire, but also of care. And in that care, a fundamental aspect comes into play: sexual health. Although often neglected, this is a topic that becomes even more relevant as time goes by, not because the aging body is fragile or incapable, but because it needs special attention, constant listening, and preventive measures that ensure not only pleasure, but also comfort, safety, and well-being. In old age, the body undergoes several natural changes: hormonal, immunological, structural. The mucous membranes, for example, tend to become thinner and more sensitive. This can cause discomfort during masturbation or sex if there is not enough lubrication or if the movements are too intense. Small cracks or irritations can appear and, although often ignored, can become a gateway for infections. That is why the use of quality lubricants, preferably hypoallergenic and specific for the intimate area, is more than an accessory. It is a protective measure. The same goes for choosing sex toys, which should be made of safe, non-porous materials that are easy to clean and free of toxic components. Medical-grade silicone, tempered glass, and surgical steel are examples of recommended materials. Low-quality products can release harmful substances, irritate the skin, or accumulate bacteria, and that's not compatible with self-care. Intimate hygiene, although often treated as a simple matter, takes on a deeper meaning when viewed with the attention it deserves. Washing the genital area with warm water and mild soap is essential, but excessive cleaning, the use of perfumed or harsh products, or even douching, can compromise the natural flora of the area. In women, this can cause dryness, itching, burning, or infections such as candidiasis and vaginosis. In men, it can cause inflammation of the glands or foreskin. Masturbation with dirty hands, contaminated objects, or in unhygienic environments also poses a risk. Therefore, washing your hands before and after masturbation and cleaning sex toys before and after use with appropriate products, or at least with water and mild soap, is a simple gesture that makes a big difference. Another fundamental aspect of sexual health in adulthood is paying attention to signs from the body that are often taken for granted or ignored. Persistent pain during touch, unusual bleeding, changes in the smell or texture of genital secretions, persistent itching, redness, or a burning sensation are symptoms that should be taken seriously. Not because they necessarily represent something serious, but because the body is speaking. And listening to the body with respect is one of the most sincere ways to experience pleasure with awareness. Visiting a gynecologist or urologist regularly, even if you don't have a steady partner or are not sexually active with other people, is part of this care. Sexual health does not depend on who you are in a relationship with, but on how you relate to yourself. There is also a point that is often overlooked in many discussions: the prevention of sexually transmitted infections, STIs. It is common to think that these conditions only affect young people, but this is a misconception. Many older adults begin new romantic and sexual relationships after long periods in monogamous relationships, and they do so without proper protection. Condoms remain an important ally, even for those who are sexually active in their later years. Even if pregnancy is no longer a concern, diseases such as HIV, syphilis, gonorrhea, and genital herpes do not discriminate based on age. Having clear and up-to-date information on these issues is essential for making safe decisions. And this information needs to be accessible, without judgment, without taboos, without infantilization, because the right to health does not expire with age. In addition to the physical and preventive aspects, emotional safety also needs to be part of the conversation. Many older adults still feel embarrassed to talk about their sexuality with healthcare professionals professionals, partners, or even friends. They feel ashamed to ask questions, seek help, or say that they have desires or masturbate. This creates a sense of loneliness that should not exist. Having access to a welcoming environment where it is possible to speak without fear of judgment is also a type of hygiene, the hygiene of emotions, thoughts, and traumas that have been pushed under the rug for so long. Masturbation, in this context, can become a tool for listening, not only to the body, but to what that body wants to say, remember, and heal. It is a space for reconciliation with parts of yourself that may have been forgotten, neglected, or dormant. Taking care of your sexual health in old age is, above all, an act of self-respect. It is recognizing that pleasure deserves to be experienced with comfort and responsibility. That touch can be safe, gentle, and profound, that it is not about indulgence or luxury, but about presence. It is affirming that the body is still home, even with all its changes, and that every home deserves to be lived in with care. Every act of care, washing your hands, choosing the right lubricant, paying attention to your body's signals, visiting a healthcare professional, is a way of saying, I deserve to feel good, I deserve to be whole. Because living your sexuality in maturity is also that, an exercise in dignity.